Welcome back, dear viewers. Our first guest of the evening is Dr.علي العجمي, dermatologist and FRCPC, DABD, FAAD Fellow at Johns Hopkins Hospital, USA. Dr.علي, good evening.
Hello, good evening.
It's really our pleasure to have you with us tonight on a phone call on Hala Kuwait.
Thank you so much for having me.
It's our pleasure, sir. So, Dr.علي, will you please tell us first, what is the definition and the mechanism of itch in our bodies?
Okay, that's a really good question and complicated. So the itch
itchy.
is the most common skin-related symptoms, and just simply it's defined as unpleasant sensation that occur in the skin, and it's exclusively in the skin because the internal organs, they don't have the same feelings. They usually, the sensation there in the internal organs is present as a pain instead of itch. But the mechanism of itch, it share a lot of similarities with pain. In fact, they follow similar nerve pathways. However, the itch is more complex, and besides having this nerve component, there is also an immune component. And until today, scientists are still learning and discovering new things about the itch mechanism. Yeah.
Is it related, Dr.علي? Is it a psychological aspect, or it's something related to the skin directly?
So yeah, it's actually multifactorial. There are many triggers. That's why it's very complex, and we're still learning a lot. And this aspect of skin condition is evolving now very rapidly in a positive way. But yeah, it can be psychologically, it can be physically, it can be related to internal organ disease or external trigger, maybe genetic component. So it's multifactorial. Yeah.
Definitely, doctor. So is it, doctor, possible that patient can have itch with normal looking skin, and what are the causes of itch exactly?
Okay, so yeah, it can happen. Actually, studies showed that 25% of patients with itch, they have systemic diseases reason or internal problem rather than primary skin condition. So one out of four, they have internal cause of itch with normal appearing skin. So that can happen. And talking about the causes, there are many causes of itch and many classification. It can be classified as localized cause of itch versus generalized. There is itch due to primary skin disorder, such as eczema, psoriasis. It's just pure skin problem. Or it can be related to systemic internal diseases like liver disease or kidney disease or thyroid problem. And rarely it can be actually related to systemic cancer like lymphoma or infections. Other causes can be related to nerve damage. It can be, as you mentioned, psychiatric disorders. Yes, it can happen. Or external causes like chemicals or medications. Yeah.
Okay. So itchy is likely it's common between people, but when exactly, Dr.علي, we have to see a doctor? Like when itching becomes serious?
Okay, so there are 5 scenarios where the patients really need to see their doctors. The first scenario, if the itch lasts more than 2 weeks and does not improve with self-care measures or over-the-counter medication, here the patients really should seek help. Second scenario, if the itch is very severe and distracting the patient from daily routines or preventing the patient from sleeping or affecting him or her psychologically, here also a patient should seek help. If the itch comes, this is the third scenario, if the itch comes suddenly and cannot be easily explained, also the patient should really go and see a dermatologist. The fourth scenario, if it's very generalized and the itch affecting the whole body. The last scenario and the fifth scenario, if the itch associated with other signs and symptoms like weight loss, fever, night sweat, and we call them the alarming signs or the red flags. If the patient felt those red flags, they should really seek help immediately because there's maybe a very severe condition happening there.
Definitely, Dr.علي. Is there what are like the or is there any available treatments for itch in general, however it looks like or whatever it looks like?
Yeah. So yeah, that's really good question. The answer is it's really hard because and sometimes it's challenging because the treatment there are a lot of treatments available, but it's always depend on the underlying cause, the root of the problem, and then we design the treatment for based on that. So the dermatologists need to take really good and detailed history from their patients, and they have to do very, very good physical exam. We depend on our eyes. We don't have a lot of tests we do. Mainly we depend on our eyes and the experience. So we need to take good detailed history with the help of the patient. Sometimes it's very challenging to find the cause, and the doctor should work together with the patient to find the trigger. Also, the doctors can actually request a few blood tests to look up if there's any internal problem. Sometimes they need to do skin biopsy for specific conditions, but the patient should understand that sometimes it can be really complicated and need to try different treatments, and each patient can respond differently for the same medication. So it can be challenging. But in terms of medication, yeah, there is. We can start with topicals, moisturizers, creams, cortisone creams, non-cortisone creams that can have the anti-inflammatory effect. We have the pills, injections, light therapy. So there is a lot of treatment, but all depend on the cause, the severity, and the distribution of the skin problem.
Yeah, and also, Dr. Ali, when it comes to the psychological aspect, does it like by time develop and become serious? Like when you itch, let's say there is some psychological motivation that drives you to itch your body or to itch your skin. Does it become serious, or it's temporary most of times? And what is the best solution for it?
Yeah, honestly, it can be really serious, and it can affect the whole life of the patient. Some patients actually they can have severe depression, and unfortunately, sometimes it can go really far, and they can commit suicide because of the itch.
Yeah.
It can affect the life really, really much. And as I told you, it's because it's complex. It has nerve components, it has psychological components, and it has immune components. So it's connected from different aspects. And the doctors and the dermatologists should invest a lot of time to rule out all other physical problems before saying it's just psychological itch. We have to do all what we can do, like blood tests, skin biopsies, until we find the trigger or the cause.
Yeah, doctor, there's a lot of parents, I'm sure they're watching now. They always like want a solution for their children. Sometimes they itch their skin, and they are so much young, like to understand the directions or to obey their parents. So what is the best solutions to distract them from itching their bodies?
Yeah, exactly. So as I mentioned before, it's like it's most complicated symptoms in terms of mechanism, and it's challenging to understand it for doctors and also to find the treatment. But always there's a hope, and it's evolving really fast. I would like to reassure patients. Currently, it's in the past few years there are a lot of new treatments available for those patients. Currently, many researchers are working on new treatments that can improve the quality of their lives for many chronic conditions like eczema, psoriasis. Now there are many different treatments can be used. There's a great team of dermatologists and researchers here in the United States working at Johns Hopkins Hospital, and they are doing really amazing job in this field.
Yes,
and this is under the leadership of Dr. Sean Quatra. He's the associate professor and the director of Johns Hopkins Itch Center. And I'm very fortunate to be part of that team. Here, many patients actually coming from different parts of the world seeking help after they almost have lost hope with their skin condition. And I would like to reassure everyone, like there is really, really great treatment. And you have to go to the right person. You have to actually not ignore it and come as early as you can, because sometimes if it's late, it can be really complicated to find a treatment. So the best thing that is happening now with this itch problem is how to diagnose it as fast as you can, and to reach the diagnosis, and then to give the treatment earlier is better.
Yeah. Dr. Ali, is there any advice you would like to give for the viewers regarding itchy skin?
Yeah, so my advice in general, always try to give your doctors a detailed history about your condition. Don't hide anything. Also, if you had skin problem, try to take pictures of that rash with your cell phone to show to your doctor, because skin problems are very dynamic, and the shape of skin eruption can change from time to time. And it can be very challenging to diagnose the patient. So pictures are really helpful. Also, it's very important for the patient to understand their condition and try to read about it from most updated, reliable websites. Also, ask your doctors to explain to you your condition. Try to avoid Google as much as you can. Google is not really great doctor and can confuse patients. It can scare them and can provide false information. And it's not really evidence-based info, so it's better to go to the good sources. And I just want to talk about something. There is a new platform in the social media that's really I recommend. It's called Zwara Tabbiya. It was established 2.5 years ago by Dr. Anas Al-Aidan, who is a rheumatologist currently in London.
Is it a phone app?
Platform is it's a platform in the social media.
That's great.
Interested in the health promotion, education, and many short videos, like 1,000 minutes of educating videos. I really recommend to follow that and to learn. Yeah.
Definitely. And people like you, Dr. Ali, also, we are really proud to have a doctor like you. And you really give us a valuable information tonight regarding the itch and diseases and problems related to the skin. Thank you so much for being with us in Hala Kuwait, and hope to see you soon, inshallah.
Thank you so much.
Thank you. It's our pleasure. Thank you. Pleasure is ours.